And thank you again, Tom, for doing this.
Absolutely. Welcome aboard. I'm going to go ahead and share my screen. All right. So hopefully everybody can hear me okay and see the presentation okay. And then I'll just admit to everybody that's coming on in.
Actually, I can admit them, Tom, so don't worry about that. I'll do the
Perfect.
admitting. You just go ahead.
All right. So hopefully everybody can hear and see me okay. I'll give you a thumbs up. All right. So today's title, Don't Be Spooked by Your Medications. We are here to help you. And my name is Tom Stow, transplant pharmacist here at Mayo Clinic. So I'm going to go ahead and start away. All right. So choosing a pharmacy. You want to make a decision before transplant to avoid any delays in discharge. And pharmacy and social work really gets this all wrapped up. We like to get the pharmacy chosen, wrapped up at the time of listing. So like I said, there's no delays on the back end. Pharmacy must consistently stock transplant medications. Yeah, it's a good idea to have overnight processing and delivery at no charge. Familiar with transplant meds. Types of pharmacies are listed there: local, retail, mail order, and specialty. We work with specialty pharmacies because they carry all of the medications. They can ship to you at no charge, and then they also supply a pill organizer or a pill box as well. So insurance and billing, pharmacy must be able to bill multiple insurance plans. Pharmacy should be able to give you like a price estimation of what that's going to cost you, and also must be in network. And pharmacy choice will depend on your insurance. Like I said, we're getting that all kind of wrapped up at the beginning stages, right at the listing time before you're listed. So that's all set to go. And then my last point, this is big. This is even before transplant and afterwards as well. Never let your insurance lapse. Your insurance is very important. And then also too, the pharmacy could delay billing, and maybe they give you some to tie you over. They can always rebuild a claim later. So never, just because your insurance changed after transplant, don't stop taking your meds for any reason. Social work could help as well if needed. Ask questions. So you should know what your meds are for. Why are you taking it? How long you're going to take it for. If you forget to take a dose, we'll go over that. Food or drinks you should avoid. I'll kind of hint on that on a later upcoming slide. And if you experience any side effects as well, report those in clinic, and coordinators will also give you a means of potentially contacting them on that piece. Any interactions, we're always looking out for that, and we're able to always assist with that from a team perspective. Types of medication, those are listed there. 3-drug combination, doses may change over time. Medication adherence is very important with those immunosuppressive. That's your lifeline to keep the organ in your body, and you'll be on some form or forms of immunosuppression lifelong. Anti-infective meds, those are listed there. Antibiotics, antivirals, and antifungals. Miscellaneous, that would be blood pressure, cholesterol, as an example. Here's your immunosuppressive meds. Your first group is your calcineurin inhibitors. Tacrolimus, also known as Prograf, cyclosporin modified. Those are the brand names listed there. Typically, if you were on that, it would be cyclosporin modified. That's what's usually dispensed if you are on that. Second class are your antimetabolites. Mycophenolate, also known as Cellcept. They do make an enteric-coated if needed, Myfortic. And then there's the azathioprine as well in that same class. Prednisone. And your last class are your mTOR inhibitors, sirolimus or everolimus. Immunosuppressives, most common combination, tacrolimus, also known as Prograf, mycophenolate, also known as Cellcept, and prednisone. Here are some side effects that could potentially occur, not to say that they are going to. It's kind of like a little FYI, just kind of be aware of them. Tacrolimus sometimes can cause some potential tremors. That's usually during the first part of your when you start out with transplant, when you're on a higher goal range, and as you're just getting used to it. After that first month and later on, those tend to go away. You can also use calming techniques too if that did occur. And elevated blood sugars, blood pressure, and cholesterol could occur. And changes in electrolytes, we're watching your kidney function. Mycophenolate, maybe some GI discomfort could occur. Maybe taking it with food helps alleviate that and just keep that consistent. And we're also watching, and we could also on that piece, we could also, as we work with the team, update the dosing on that, or the dosing frequency, or maybe we add the enteric-coated version. Those are some options we could do as well. We're also watching your CBC, which is your complete blood cell count. And for prednisone, there's changes in mood, insomnia, and could elevate blood sugars and blood pressure. We're also watching for that. Antibacterial, for our anti-infectives to start out, so it's sulfa or Bactrim. That is the mainstay. If you're allergic to that, we do have alternatives available, such as pentamidine or dapsone. Antiviral, we're going to check the viral status of you, the recipient, and also the donor organ coming in. And based off the positivity and negativity of those tests, that would dictate which one you're on: valganciclovir, also known as Valcyte, or acyclovir, also known as Zovirex. The last class, antifungal. For our kidney transplant patients, we're using nystatin. That's just during the first part of therapy, the first 30 days. And for our pancreas transplant patients, we're using fluconazole. That is just for the first 30 days as well. Anti-infective meds, Bactrim could increase your risk of sunburn. There's also changes in kidney function. We're watching your serum creatinine. Could potentially elevate your liver enzymes, could increase your potassium, and we're also watching the CBC, because those could be lowered as well. So we're watching for all that in your lab work. Acyclovir and valganciclovir, those are your antivirals, and more so with the valganciclovir, that could decrease your blood cell count. So we're watching for that in the CBC. Miscellaneous medications on Dancitron could relieve nausea. For constipation, we're usually using like Senna Plus or Miralax to help with that. For pantoprazole, omeprazole, those are your meds if there's any reflux or heartburn. For insulins, those are listed there. There's the short-acting with the Humalog or the Novolog, and your longer-acting, the Lantus or the Levemir. Those are typical ones for those long-acting ones. Blood pressure meds are shown there. Your anti-cholesterol meds to lower cholesterol, magnesium oxide. The tacrolimus will potentially could lower the magnesium levels, so we have that available. And sometimes the tacrolimus could raise your potassium, and so we usually use Lokelma to help with that, to keep that in check. Management of side effects for nausea and vomiting. It may be as simple as taking it with food to help alleviate any of that, some of that GI discomfort. If needed, we do have on Dancitron available, which could be prescribed on an as-needed basis. For constipation, we have Senna Plus, Miralax, and for reflux or heartburn, omeprazole or pantoprazole, like I said before. This is a big one on this next one. Wear sunscreen, SPF 30 or higher when you're outside, to prevent any sunburns that could take place, which could lead into skin cancer. So we want to do that. Also watch those cloudy, hazy, overcast days where the sun could burn through those thinner level clouds and get you burnt that way. So we want you to get protected. Also not a bad idea to wear caps or hats, which could help your scalp and kind of shade you a little bit. Birth defects. So if you are a transplant patient and you are a woman of childbearing age, we would say use mycophenolate, also known as Cellcept. If this applied to you, we'd give you a brochure outlining this process in the hospital. Or there's abstinence, or if you want to have the glorious gift of having a child, then just have those discussions with your team and we could do an alternative plan for you. Your meds, transplant meds could elevate your blood pressure, cholesterol, and sugars. If that was the case, we have meds to manage. One caveat is when you're on prednisone, some patients' sugars get elevated, and so we use insulin to help manage. If you are on insulin, as we taper that prednisone down, the insulin needs get adjusted as well. And as you further taper down, most patients are able to come off the insulin if it is prednisone-induced high blood sugars. All right, so your immunosuppressive medications. Take your meds every day and on time. Do not miss your doses. Never stop taking your anti-rejection meds unless specifically told to do so for some reason. Be consistent with regards to meals. So take your meds with food or without food. Just keep it consistent. The med will work either way, but we want you to be consistent. So when you're getting lab values, it keeps those in more stable in check. And that will help out our team, especially our wonderful coordinators. Avoid grapefruit, pomegranate, pomelos, starfruit, honeybell oranges, which is a hybrid of a grapefruit, and Seville oranges. Your regular oranges are okay, lemons are okay, limes are okay. Check your ingredients just to make sure nothing's hidden in there. And this next one, don't start any extra supplements without letting us know. We want to avoid any interactions that could take place. Sunscreen 30 or higher, like I said, avoid pregnancy, and we talked about that. And take your meds after the labs on lab day, just so there's no interference with those labs. All right, here's some extra tools to help you remember. Mobile apps, they alert you to take your medications on time. One of the first two, those are free of charge, My Med Schedule Plus and Mango Health. They can do alarms. You can print out a little pocket schedule for you. And so it's kind of almost like a digital med schedule for you. It alerts you when it's time to take your meds. And that Mango Health will even give you rewards if you're for staying healthy. Maybe it's for exercise, taking your meds on time, and being good stewards of health. MediSafe medication management and DoseCast, those are some other apps. I did look, those are in the App Store for charge. Smart pill bottles, it tracks you when you take your medication and knows how many pills are remaining. Adhere Tech, they work with specialty pharmacy, and that's kind of like a little program with the manufacturers, the specialty pharmacies, and you Pillsy, and they have an app available for that, and virtual assistants, that would be like your Alexa or Echo, where you can use that as an aid as well. Use pillboxes, alarms, language translation. So upper left-hand corner, that is a pillbox, 4 slots a day, 7 days a week that you could use for adherence. There's also watches with alarms, and then also you can use your cell phone as well, add alarms to your cell phone. Our wonderful interpreters are here to help you, assist you either with questions via home or in-person consults, pre and post. And then that middle box, I put a little slide there, translate. So our Mayo pharmacies, they can do meducation, and what they can do is the bottle is typed in English, it can translate it into the language that you are familiar with or need, and then it's going to list it in English and the other language that you need as well. So very helpful in that regard, and it does it on the spot for us. So if that is needed, we have a flag for that if you speak another language. Low vision resources, ask a pharmacist to print larger labels. We can do that. Mark your med bottles with rubber bands. We could use Braille. Could even use Braille coding. That is an option with us. We can work with you. Place light close to labels, so it makes it easier to see. Magnifying glass or reading glasses help. And visionaware.org is for managing medications and everyday living tips with low vision. Important points to remember: never stop taking your meds or change dose unless instructed by transplant team. Inform your dentist, other physicians of the meds you are on, and if they prescribe something as well, it's a good idea to check with us. Make sure it is collaborating okay. We can be the ones to check with that. Allow plenty of time for refills. So I always say a good 7 to 10 days. You don't want to run out of your meds. Your meds are very crucial to keep your transplanted organ in your body, fight off any rejection or infection. Notify your coordinator if any side effects occur. We went over that. And like I said, always check with us first. We want to know everything you're on to avoid any interactions from taking place. Here is, I'm going to say, knock on wood, we're, as the temperatures are getting lower, probably out of the woods here, but I guess it still could be in play. But it's just for any future as well. The first part covers emergency prescription fill. This is in event a pharmacy receives a refill request and the pharmacist is unable to get a refill authorization from the prescriber. Pharmacies can do a one-time refill of up to 72 hours supply or a vial of insulin to treat diabetes. And if there is a state of an emergency, the governor of Florida will issue the emergencies of those specific counties that are mainly affected by either a tropical storm or hurricane. And we can do spends up to a 30-day supply in those counties affected. And the prescription can be for any med, except you can't do C2s. And medication essential to the life and the overall health of you, and it's professional judgment. And then after that, we can do a written order to the physician after the fact, just to take care of that emergency in place. One nice thing is with our specialty pharmacies, those really actually wouldn't be in play. One of them is here in Florida, kind of away from probably more inland, so that would help us out. Rochester is from out of Minnesota, and there's also Amber Pharmacy out of Orlando. So those are when they're shipping, that should be a-okay on that end. If there's any storm, it shouldn't really be too much affected by that. And on behalf of Tom and the whole team here at Mayo, we wish you the very best on your transplant journey. Those are my references. And we could do any questions. Did you want to do the poll questions first, Pat? Or
yeah, let's run the poll.
Let's run the polls.
Yeah, and then we'll ask for questions. We'll open it up.
Fantastic. Thank you all for joining today. I threw in a little holiday colors for you.
We appreciate that. Everybody seeing the poll questions?
Yeah, we answered them beforehand, so
And that's okay.
That's
all right.
Like to change our answers.
That's all right. I think there's still some people who didn't answer them, so it's okay.
Question, Tom, about the hurricane medication refills.
Yes.
So if there's a hurricane coming, doesn't the governor, he lets you get your medications refilled even if it's not due yet? Like, let's say you have a week left, can you go get them refilled without being charged?
So how that would work is he'll issue the warning and he'll say these are the counties affected. And so it's really about making sure the pharmacies, the ones that are covered, because with a storm, maybe that pharmacy was affected. So maybe they have to go to a different pharmacy or that type of thing. So basically what it's doing, it's allowing you to get meds, hypothetically some patient has their meds in the house. They can't get to their house. So that's really what
Okay.
it's about.
What
Yeah.
it's for.
What they
Okay.
do, we get alerted like, hey, these are the counties affected, and we're always going to be able to help them out. So
Thanks.
you're welcome.
Okay, we're going to end the poll and then we'll share. So Tom, if you could go through these. Are you seeing them?
Yes. It says, which of these is not an immunosuppressant? So the answer would be C, valganciclovir. That is an antiviral. So a lot of times when you see that VIR, that is for, I think virus. So that is an antiviral. So that would be the choice. So good job, everyone. Which fruits can interact with tacrolimus? And that is grapefruit, pomelos, Seville oranges. And the answer would be D, all of the above. Fantastic. And 3, which of these is not a medication app? My Med Schedule Plus, Mango Health. C, honey, where did I put my pills? The answer would be, honey, where did you put my pills? That is not an app that, at least I'm not aware of. That might be a question in the household. Honey, where did I put my pills? But as I've always learned, if you ask your significant other where things are, the chances are you're the problem. And that is actually true. Sometimes where it's you that misplaced it. Little joke there. Morning labs got delayed until 9:30. When would be the best time to take your transplant? So there's a little wiggle room there. So what you always want to do, just in case the lab got delayed, you do take it after the lab. So the answer would be just after the 9:30 a.m. lab draw. You could do it when you arrive home if your home's not too far away, but actually the best choice would be after the lab. That's where those pill boxes can come into play too, where you carry the day with you and you have it with you. It's kind of nice just in case you're around in clinic for an extended period of time. Which SPF sunscreen should be used for kidney pancreas transplant patients? Everyone got it right with 30. Fantastic. And I think that's it. Fantastic. Thanks for playing, everybody.
Okay, so any questions? You guys can raise your hands or just unmute and come in and ask your question.
Yeah, has anyone ever eaten a Seville orange or a pomelo? In my 15 years of doing transplant, I've never had a patient even know what those are.
Yeah, that was a trick question. We don't like that question.
It sounds like the voice of Jennifer. Am I right on that?
Yes,
That was
and
me.
Rhonda.
Yes. Yeah, interesting question. I do go over that. I personally haven't seen pomelos or Seville oranges in the grocery store. So yeah, so the answer is you wouldn't use those, but so the other oranges are in play. Interesting enough, I have seen orange, it actually says Seville orange marmalade, and I've seen it at Trader Joe's. It does have Seville oranges in it. So
I did include that in my teaches. If you're going to eat marmalades, look to see the ingredients.
Yeah, it's a very good point. because a lot of, let's say the European marmalades, it's Seville orange marmalade. Trader Joe's does have, and it actually says it on the label, Seville orange marmalade. But a lot of the Smuckers or that type of thing, it's actually, they're not going to get their oranges from Spain. It's actually sweet oranges, and the ingredient label reflects that. So it's actually sweet oranges. So, but
Tom,
yeah, good tidbit.
I'm sorry, Tom. Also,
Yeah.
the citrus sodas also increase the prograph levels.
Yeah, more so if it would have those. Yeah, we always tell them with the grapefruit, and yeah.
Like
no,
Fresca.
even Sprite. I've had several patients that had Sprite and it increased their levels.
Interesting.
Yes.
I
A
never
lot
had
of the
anyone with that.
citrus sodas. Yes, a lot of the citrus sodas in Mountain Dew, Mellow Yellow, also increase the levels.
So yeah, with the mainstay with that would be the grapefruit with that, and those are the ones, clinically that we've seen. That's the main take home. I think the main take home is read the ingredient labels.
So other questions?
Is it 1 or 2 pills a day that we got to take after the transplant? That's what I was wondering.
So it will vary from patient to patient. So let's say the mainstay that you're going to have to do is typically it's 2 to 3 immunosuppressants, 3 anti-infectives. So that's going to give you 5 or 6 right there, plus anything else. Usually there's a multivitamin involved. There might be magnesium involved, maybe insulin involved. So that can be, maybe if there's a blood pressure med involved, it could be right around 12 to 15, maybe at the start. And then that should kind of lower as time goes on.
All right.
Just go ahead and unmute yourself if you have a question.
Yeah, it's a lot of pills, but you'll be all right. You can handle it.
Yeah, and I think I think the main thing is those pill organizers. When you get that set up, I think that helps you out because basically you've got your slots available, and you're taking those at that time, and so if you look at it, all your bottles at once, you might be overwhelmed, but once you've got things organized and you're getting used to it, it gets a lot better.
Yes, question. So after a year, how much of that medication that you'll be currently taking, how much will after the 6 months, 6 months, you'll still continue to take?
So at that point, you're down to 2 to 3 immunosuppressants. Those anti-infectives are gone. So that's just gonna, for sure, it's gonna drop 3 of those off by that month with the anti-infectives. And then maybe at the start, maybe you're on a magnesium supplement, and then later on you're not because your magnesium is in range. So that maybe falls off. So you do lose, you might lose 3, 4, 5 meds maybe by that point, and depending on the individual.
So, question. So, I couldn't get my situation. So, we said that a lot of the citrus fluids you won't be able to do. It's not good to do. Okay, now you got gate aid. Will you be able to use gate aid?
What was that last question?
I heard the conversation about some of the citrus beverages.
So was
Okay,
it Gatorade?
can you use gate aid?
Gatorade? So Gatorade would be, usually we'll do, water, Gatorade. Gatorade can be used. It's just a matter, you're getting labs frequently. You do have to kind of watch the potassium just to make sure you're not overdoing it on the potassium piece. You're getting regular labs, so you can use Gatorade. I would probably use more water, but a Gatorade here and there, as long as you're not overdoing it and your labs are in play and checking within normal limits.
Okay, okay. So the actual lab date would be once a month. How often would that be? Will I be taking?
Yeah, the labs would be obviously more frequent at the start, and then they taper off over time. But you're getting frequent labs definitely at the start of your transplant.
Oh, okay.
They'll be weekly for the first 4 months after transplant.
Right. Okay. Okay. Well, okay. So basically, that'll be when I come every week to the clinic. You'll do labs, right?
Yes.
Okay. So will I get the results immediate? Like a lot of my when I come and do my yearly evaluation, I almost get all my results immediately. A lot of times before I even leave the place, I have my result. So will that continue?
Yeah, so when the labs are very quick here, so we usually get results because a lot of times the labs are 7:30, 8 in the morning, right in that range. And by the time I'm hitting my 8:30 appointment, a lot of those labs are actually back already. So we get those labs very quick. The
Tacrolimus is going to take longer. Your
tacrolimus would
tacrolimus.
probably right around 2 to 3, right around 3 o'clock. You're going to get that back.
Okay.
And if there's any like viral testing that can take a little more, you're not going to get those results right away. But a lot of the labs are right away. The tacrolimus is the one that is in the afternoon that you'll get that back, and you can see it in the portal.
Okay. Okay.
Or in clinic. Yep.
So in the event that for some reason I need a prescription that was not in the preferred list of medications, and I'm not at the hospital, not at the clinic, so y'all send it to a local.
Oh, I see what you're saying.
Pharmacy.
Yeah, typically after a while, it's where you need it, maybe it's quicker or that type of thing that could be potentially arranged. Yes, we'll just work with the team on that. Typically we got a pharmacy here on campus in the Davis building, our community pharmacy. That's usually that's quick right here and there on campus. But yeah, work with us on where you can get it so that you can start your therapy the quickest. Sure.
Oh, okay. Thank you.
Thank you.
So one thing I want to reinforce in the social work end is never ever go without these meds. If you're ever having a problem filling your meds, please reach out to the social workers or your coordinators or both and give us a heads up. We do try to help you resolve any issues that you have getting your medications. And also I want to tag on to what Tom said too about carrying your meds around with you. The best transplant patients carry their medications around with them all the time. So always have a day's worth of meds on you. Most of us live in Florida and Georgia. You can get it in an accident, behind an accident here and be on 95 or 75 for 4 hours, which may mean you're due for meds. So always carry a day's worth of meds with you, if you can.
Okay. Got it.
Any other questions? Can't let Tom get away this easy.
I mean, after we get the transplant, how long would it like actually take before we can like get back active, like, you know, like going back to work or something like that?
I think I might field that to a coordinator if possible, because they usually have that criteria.
Usually 6 weeks, 6 to 8 weeks, because it's an abdominal surgery, but 6 to 8 weeks.
All right, yeah, because I stay in the gym a lot, like just doing a lot of cardio right now, you know, so I'm just trying to make sure I keep my wind up to par. So I was just wondering, you know, so that's why I was asking that question. Thank you, I appreciate it.
You're welcome. You won't be able to do any weightlifting for a little while after transplant, okay?
Yeah, right now I'm not even doing weightlifting. It's just more cardio right now. Cause actually when I went into to the hospital that night, I was coughing up blood. Then when they put me on dialysis and all that, now I left the hospital, like I was still kind of fatigued. So that's why, you know, I'm working on my cardio more because I want to make sure my winds stay up to par because I didn't like that feeling.
Okay, you will be able to walk, not on the treadmill, but you will be able to walk right after transplant. You won't have to wait 6 weeks for that.
Oh yeah, yeah. Okay, thank you, yeah. But you know, I ain't doing no weightlifting right now because I know they want to keep my weight down and all that. So yeah, it's just cardio. But thank you for educating me on that. I appreciate it.
You're welcome.
Yeah, the surgeons typically like you up walking about 12 hours after surgery. So when you have your surgery and your nurse comes in and says, "All right, it's time to go for a walk around the floor," get ready. But the more you walk, the better you're going to heal.
I have a question. Can you hear me?
Yeah, go ahead. Go ahead. Who was trying to ask the question? Because I think you muted.
Okay, can you hear me now?
Yes.
Okay, we've been urged not to miss any doses of medication. In the event that occurs, is there a window to where we can make up that dosage?
So typically we're here. Let's just say tacrolimus, we kind of use about right now we're kind of using about a 4 to 5 hour rule with that as a grace period. With that off your regular scheduled time. We obviously you want to take it as close to your, you know, typically we go 8 a.m. and 8 p.m. So you want to be as tight as you can within that hour. But just in case, hypothetically, lab got backlogged or you're watching television and you fell asleep at night, that gives you a little wiggle room just in case.
So Tom, why is it so important to take these medications at that 12-hour mark? Why is it so important?
It has to do with the blood level, to keep rhythmic blood levels. So right around that 12-hour mark, you're at your low point or your trough. And so you want to get that back up so it doesn't dip below. So we just don't want any of those. Keeping normal rhythmic blood levels keeps those, I'll call them enemies or your antibodies away, so it doesn't try to go after your transplanted organ, your kidney or your pancreas.
Is
It's
that
also important getting your labs drawn on time too. That makes a difference with the trough level. So if you
Yes.
take your medication at 8 and 8, you want to get your labs drawn close to 8 as possible, because that's how we monitor and dose your medication. Because we can underdose you or overdose you, so that's very important.
so? It's every 12.
Is that in that 4 to 6 week period after a transplant? What happens when you get home and you're going through your med regimen?
You will do the same as you're doing in post-op clinic.
Okay. So
Is
only that 4 to 6 week period is when the blood's going to be drawn, the lab's going to be drawn. Once you get home, you have to worry about any lab.
That's not correct. You'll
Okay.
still be getting labs almost 3 to 5 times a day in post-op clinic. And once you discharge after 30 days, you'll be getting weekly labs for the first 4 months.
You'll get
Okay.
an order to take home. You'll get an order to take home and use at your local lab. And those results will get sent to us.
But
Okay.
yeah, and it's still important once you go home to keep up with the same, taking your medication at that 8 and 8 and getting your labs drawn close to 8 as possible.
so we got to
Okay.
take medication every 12 hours?
Usually, yes. The tacrolimus is an every 12-hour medication.
All right, thank you.
Mhm.
And what about the CellCept and the prednisone?
The prednisone is once a day, the CellCept is every 12 hours.
So we got two. It's going to be every 12 hours. The tacrolimus and the CellCept.
You may have more. It all depends on what blood pressure medication you're on as well.
Oh, okay.
Also, too, on the prednisone, it's real nice, and we look at that as well in clinic on our post-discharge consult. It's real nice. They give you a prednisone taper on the back of the book, logbook, and so it has your dates all laid out for you, and so you just follow that plan and follow it accordingly. So very helpful for the team and for the patient as well, and caregivers.
Tom, there's a couple questions in the chat. There was one that asked about, will drinking water prior to labs change the results of prograph levels? The answer is no.
Correct on that. It would not. If it doesn't manage missed testing, we went over that. Does temperature affect the meds? It can, yes. So typically, excursions up to I think it's 86. So normally it's room temp. There's a little bit of excursions. I would say the main thing with that is I would not store your meds in the car, especially here in Florida, because it's going to get hot. So if you take your meds with you, that's kind of nice why you have your pill organizer where you can pop it out for the day. Let's say you're doing errands, then just bring it with you, but then put it in your purse or pocket, that type of thing. And when you go inside to, if you're doing errands, take it with you. I wouldn't leave it in the car.
Question. So this medication is separate to the medication we presently taking. Like, for example, I'm on 2 blood pressure medicines now. I'm on dialysis. Okay, so when the transplant happens, I'm going to get more blood pressure medicine, right? Possibly.
Typically when you're on blood pressure meds before transplant, you're usually on them afterwards. How many, it all depends. But typically that would probably be the case. You might be on a few blood pressure meds afterwards as well. All depends on your blood pressure.
Oh, okay. Okay. All right.
Some more questions, guys. Is anybody worried about swallowing all these meds after their transplant?
Good question. I forgot because right now I like bananas, but I can't have a lot of bananas. So will that change? Fruit, banana,
Bananas would be, obviously potassium and magnesium as well. So it's not that you can't take them. It all depends on, your labs. So sometimes, let's say your potassium is elevated, they might say, okay, avoid some of those high potassium rich foods. Those would be like, I'll just give you potatoes, sweet potatoes, your citrus fruits, maybe bananas. So it's not that you can't, you just have to, depending on your labs and things like that,
Okay.
kind of instruct you accordingly.
So a substitute would be applesauce.
That would be yes, that could be an option. Yes.
Okay. Thanks for the question. I hadn't thought about that.
Thank you.
So have all of you already registered with your specialty pharmacy?
Yes.
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 Good.
Yes.
Okay, so if you haven't, you need to.
It's been a long time. So would I need to give them a call or what? Because
Actually,
I did the paperwork and everything, made my choice and all. So
the social workers will usually tell you during your update appointment if you need to register or if you need to re-register because you've had an insurance change. If you have commercial insurance and your commercial insurance changes, we're more likely to tell you to re-register or to recheck your registration to make sure your costs are right. If you're a Medicare or a Medicare Medicaid or a Medicare with a supplement, we probably have a good idea of how much your meds are costing. And right now, for the last few years, the costs have gone down. Right, Tom? Isn't that what you're seeing on your end too? Is that the costs are coming down every year?
I would say so. It all kind of depends on your insurances, but I would say that that's fair.
Yeah. So we'll tell you, the social workers will tell you if you need to do that again.
okay.
Okay. Is everybody ready for Halloween?
Yes, we are.
Yep.
Okay, good. Okay, well, I think we're going to wrap it up. Nobody seems to have any more questions for Spooky Tom. So, and Tom, thank you again for doing this. I love the spooky, and we had lots of people registered for this. So I'm really glad that you did it, and it's important information. If you guys,
thank you all, and best wishes, prayers, and peace upon you as you journey forward. We are always here to help you, and I am very grateful that you all joined today.
Yep.
Thank you.
Thank you for hosting.
Thank you. Thank you very much.
Thank
Thank
you.
you.
thanks everybody.
Thank
See you next month.
Yes.
Right. That's it.
Leave.